Hello. I am Bobbi-Jo. I use she, her pronouns. I'm really excited to be able to talk with you today. Can you just start by kind of sharing your name, your pronouns, and then just a little bit of information about yourself, whatever you feel
Yeah,
comfortable with?
I'm Kat. I'm she, her, and I'm a cis het white woman who is 54. Um, I currently live in a very rural part of Northeast Alabama on the Georgia and Tennessee border. I'm divorced. I was married a long time to another person with ADHD. And I have two kids with ADHD who are grown. They're 22 and 24. So,
Thank
oh,
you.
I'm a clinical social worker.
Okay. Yeah. And tell us a little bit about how you came to learn about your ADHD and kind of what that process is like for you.
Well, um, I saw my husband at the time, and I saw a primary care doctor who really identified it for both of us. Just a, regular general practitioner. He had a lot of special interests, and he identified that, and it made sense to me. But I still didn't really get it, and that was like almost 30 years ago now. And I tried some stimulant medications. And while they helped on some level, the amount of irritability that I would feel coming off of them was not really conducive to my marriage and later having
Mhm.
kids. So I kind of just put it to the side. I knew that I had it. I knew that my husband had it. And later on, very quickly, when my kids were little, that my kids had it. But my understanding of it was about the same as as the general population's understanding of a squirmy 9-year-old boy who gets in trouble at school.
Mhm.
So I really have only learned more in this past year at 53, and sort of doing a deep dive into, I didn't understand that it was a form of neurodivergence,
Mhm.
and as is autism, and that there's some overlap there. And so I really had not, I've done a very poor job of understanding myself up until this past year.
Yeah. I guess now that you've kind of expanded, that understanding, what has that meant for you? Or even earlier, I guess, was there any impact that having that ADHD be identified? Whether I think you could talk about either of those points. That initial one, it sounds like maybe not a ton changed for you, but then in the last year, now that you've had this expanded understanding, has anything changed for you?
Yeah, I realize how much internalized shame and guilt I have,
Mhm.
um, particularly, at my age and growing up in the 70s and 80s was certainly not recognized as something in school. But I had so many, and I was very sensitive, but I had so many just cutting, honestly, shitty comments, particularly from teachers,
Mhm.
about how, oh, that Catherine thinks she's too good to pay attention. She thinks she can just do whatever she wants. And always on my report card, there was a number 13 that said inconsistent effort. I remember the number, I got it all the time. Um, and, I was smart. So I was kind of able to sort of limp by for
Mhm.
most of it, but really internalized a lot of negative messages about myself. And shame is cheap. It's why we use it, why parents use it, while teachers use it at a big cost, but it's cheap on the front end. And
Mhm.
internalize that so much that I do it to myself automatically.
Yeah.
So I'm doing my own therapy and really trying to get away from that. But I realize how much it's hurt my self concept.
Yeah, I guess I'd be curious, have you noticed any shifts? So since you've had this expanded understanding of what it really means, to have ADHD and seeing it as neurodivergence, has that made any difference around that shame for you?
Yeah. I can go it, I couldn't necessarily identify it as that. I identified it as a bunch of other things. I am also training in internal family systems.
Yeah.
And, there's that shame sort of exile. And instead of all the protectors out there guarding it, I can go right to it now. I know
Yep.
exactly what it is
Yep.
instead of the sadness, anger, all of the other things that were, sort of in front of it, if that makes sense.
Absolutely. Yeah. IFS is one of the primary modalities that I use, and it's also the therapy that I participate in myself personally and in my own therapy journey. And I see this mirrored with my clients. So, what I really believe, because I've seen such a pattern, is that what you spoke about earlier, that those little messages, right? That at the time might be simple, just, hey, sit still, hey, do this, inconsistent effort, you're not trying hard enough. All of those really seem to collectively build up to create those exiles, right? And sometimes there's one exile holding all of it. Personally, I have found it's been I've had frustrated parts because I've done a lot of unburdening work around that shame, and I still keep finding like new ones that are like connected, but maybe with a very specific flavor or a very specific experience that are like adjacent, right, to that bigger one. And so I think that's important for people in therapy to know, is kind of that pattern, that sometimes even when you're doing that inner work, because there's just so many messages from so many places, whether ourselves or others, sometimes we can do some deep healing work and it could all be collective and start to feel better. And sometimes there's lots of little hidden ones there
And
that
I
keep
really
showing
haven't.
up.
I totally agree with you. And I don't think I've even I've hardly scratched the surface of trying to, get at all those pockets that are in there.
Mhm.
The other thing is that I was training in EMDR, and I decided that I wanted to find a therapist because I didn't have one at the time who knew EMDR
Yeah.
so I could have the experience. So I found a therapist, and she's pretty young. She hadn't been out of school that long, but after my initial training in EMDR, I kind of felt like I got what I wanted from EMDR.
Mhm.
So I sought therapy with this therapist for one reason, and it ended up not being the reason. So my therapist, I'm about to have to quit working with her because I'm moving and she's not licensed where I'm moving. So it's okay, because she is neither an expert at ADHD, neurodivergence, or IFS.
Mm.
And I would like some combination of that the next time I seek therapy. But she has her place. And let me tell you, she is a somatic therapist.
Mhm.
And I really didn't know anything about that. And I still don't know a lot about it. But one of the big discoveries for me was how very disconnected I am from my body.
Yeah.
And during a lot of the trainings, they say, where do you feel that in your body? And I just want to be like, do you want me to make something up?
Mm.
Like, I don't know what you're talking about.
Yeah.
So that proprioceptive kind of a thing has become really
Yep.
front and center. And my therapist, maybe there's just a happy accident, but my therapist being trained in something I thought I didn't know what it was and I didn't really have any interest in it, has become much bigger for me. And I really try to pay attention
Yep.
to my body in ways that I have not before. And
Yep.
it's a little bit scary too. Like, one of my questions to her was, okay, so what if I do get in touch with my body? Do I really even want to do that?
Yeah, exactly. I mean, and then it's so complex because from my perception and everything I know about interoception differences for neurodivergent folks, I mean, some of it I think is just biological. With ADHD, hyperfocus plays a big role. Typically, when we're in hyperfocus, we lose all sense of interoception. So just like everything else with ADHD, it's variable, that interoceptive skill. Some people, it can also be the other end. Myself and at least my oldest, maybe my youngest, I would say, are on that hyper interoceptive where like I notice every tiny change and doctors look at me or my child like we've lost our mind, like we couldn't possibly notice these patterns and notice these small changes, which also has issues, right? um but I also have times where I, don't eat for 6 hours and don't realize it or haven't went to the bathroom, and so it can go both ways depending on focus. um but yeah, I think some things for therapists to be aware of with that is that I do think that somatic based therapies are really good for neurodivergent folks because interoception is a skill that we can learn, but it's also important for therapists to be mindful because I sometimes see people think like, oh, this client can't do this modality, and that's not really the case. It's just you have to be patient and be really adaptive and learn. There are some clients that can benefit from IFS but are never able to tell you where they feel something in their body, and while it's a helpful piece of the modality, it's not essential, right? And so I think that's one of those things for therapists to hear and to kind of know is like there is challenges with that interoception, and so sometimes people then think, oh, they don't have good interoception, so we shouldn't do somatic therapy, where I would say it is good and it's worth continuing to try, but attuning to the client. You don't want to make them feel more upset about it if they struggle with it, but just continuing to offer those opportunities. I see folks who are not at all in touch with their body that now are able to identify where they feel things at least some of the time, and that feels really important, um, to start to have that connection, right, with the body when available, but also to not use neuronormative expectations around that, I think is key. So yeah, it sounds like you've noticed that it's been a challenge for you to engage in that kind of thing, but at the same time also helpful.
I
uh
think so. I mean, I still have a fear that if I really get in
yeah,
touch with it, I'm going to experience a lot of pain in my body. I think I
yeah,
already have more pain in my neck, honestly. And
yeah,
so, why do I want to pay attention to that? I
yeah,
mean, if so, that's, I mean,
yeah.
maybe I'm just so early in the process. I don't know, but
I think that's
I
where
mean,
the pacing and attunement and that therapy process becomes important, right? Or if we're talking parts, we listen to those protective parts and work with them so they aren't as afraid, right? To allow us to do that. Um, because that fear is always that pain will be overwhelming. And that's the piece to learn is that hopefully we can learn that we can be with that pain and it can exist and the worst case scenarios won't happen for us or whatever. And so it's about titrating and finding that right process for each person. But yeah, I guess with let's talk a little bit about what your experience in therapy has been. How many different therapists have you had across your life, as well as you're able to remember? I know
yeah.
asking people with
I,
ADHD these questions are hard.
no, being the age that I am, I wasn't really, um, therapy wasn't as big of a thing.
Yeah.
So the first time I think I saw a therapist was when I was getting divorced. So, that's been almost 10 years now. So late. I mean,
Hmm.
40, 43, 44, something
Yeah.
like that. And I've had different therapists. Um, I've had several kind therapists, but who basically it's just sort of the head nodding and that sounds hard. And how do you feel about that? Nice enough, but I didn't come in knowing what I was asking for either.
Hmm.
So I guess you get what you get when that's the case. I had one that I called a mean therapist who was at the university. Back then, also, for the most part, was using my insurance. So that makes a big difference when you're in what you get. But uh, yeah, she was basically a researcher who came to a university that got stuck doing therapy, and really was incredibly frustrated with me when I was trying to give a history, telling me that I couldn't have an anxiety disorder unless I had anxiety in childhood. So I needed to go ahead and identify that for her. So she said a couple of things that stuck with me that were poignant. I mean, I guess you can learn as much, from a negative experience. But the other, I've probably had one, two, three. I think I'm on my fifth therapist, maybe my fourth. I haven't done it consistently throughout my
Mhm.
life, but but it was somewhat helpful, but none of them picked up on or had any understanding of ADHD or brain neurodivergence or they were basically just nice people who were there to listen.
Yeah. I guess as far as you're aware, was ADHD ever a primary reason for you pursuing therapy?
No, most of my primary reasons were sort of life circumstances around divorce, around, you know, more life transition.
Okay. You just shared a little bit about this, but any particular kind of unhelpful or unaffirming kinds of experiences that you had related to therapy?
Well, um, mm, really just the therapist that didn't want to be seeing therapy clients.
Mhm.
Um, so I don't know. Like, I think I've just come so far. Like, I would look for therapists differently than I did then. And I just know so much more. So I guess I know better what to look for.
Mhm.
And I've also, given up on the idea of using insurance,
Mhm.
um, because you kind of get what you get. It's kind of, sometimes.
Yeah.
So,
Yeah, and sometimes there are people who have really intense specialties with modalities or whatnot that choose to not utilize insurance for a whole variety of reasons. And there are also folks who do, accept insurance as well that are, really fantastic. It often is just about resources in your area and what's available and doable and all of those things, which is tricky, right?
yeah.
I have big hopes that we'll keep moving forward with some of the like counseling compacts and all of those things, so that
Yeah.
people have increased access to a variety of resources and specialties, at least through telehealth. Um, because sometimes people have really intersecting identities and needs, and so it's hard to find folks that can have those exact specialties and trainings. And therapists can't know everything about everything.
It's so much privilege because, privilege and access. It really is.
Hmm. Um, have you felt like you could be 100% yourself with your therapist, or have you felt like you've needed to mask your ADHD traits in some way, even in therapy?
I think for me, in the beginning, particularly, there was a people pleasing part. And one of the things that kind of drove me insane, which says more about me than her, is that I didn't know anything about her.
Mhm.
I still don't know very much about her. I make assumptions, but she is not a very sharing, forthcoming.
Mhm.
And I don't know, I'd be interested in your thoughts on this. Of course, as a therapist, you don't want to take up all the air in the room,
Mhm.
making it about you. But I find for me personally, my clients do better when I am more self disclosing. And
Yep.
sometimes even saying we, because, like I
Yeah.
said, so many of my clients are ADHD
Mhm.
anyway, and kind of humanizing it as a human experience, not trying to make it about myself.
Yep.
But I feel like the clients I see, maybe it's particular to neurodivergent brains, they almost need to know more about me. And my therapist doesn't give me that. And you know, I one time at least wanted to know her Myers Briggs type, and I finally, I got her to tell me that. But I think because I could be wrong. I think also because she's new, she thinks she's not supposed to do that.
Well, yeah, and I think it's multi-sided. I think as therapists, we are trained that the primary training, right, is not to self-disclose. The space isn't about you. It's all about the client and all of, that blank slate kind of thing. I know more modern things have been evolving, but I will say my experience in kind of neurodivergent affirming therapist spaces is that there is more encouragement that neurodivergent clients in particular tend, now it's still individual though, I will say, but neurodivergent clients in particular generally like and prefer some self-disclosure. I have said that I would like my own therapist to use a bit more.
Yeah.
Even just minimally, doing parts work. My system has appreciated when, he has said, something simple like, oh, I have a similar part. Even just that, right? Or acknowledging. And my theory on that is I think because we spend so much time as neurodivergent people being misattuned in relationships and being misunderstood, that at least for myself, that little bit of conveying that you actually understand helps relax that anxiety of, does this person think that I'm just completely whatever word you use to describe yourself, do they think that I'm
Yeah.
a mess or whatever? And so I think that having a little bit more self-disclosure relaxes some of those protective parts that get worried about how we're being perceived or judged or things like that. And so knowing that, oh, this person knows what it's like to do this, or oh, this person gets it, feels that in and of itself is extremely therapeutic, right? Like just feeling heard and validated beyond just the words of, that sounds blank, more of, no, I actually get it. And so I think that's the general consensus, is that, for therapists, it is good to consider, as much as you're comfortable, like a bit more self disclosure than you might with other clients. But I also would say it's good to, my recommendation for therapists is just anytime you're questioning, should I do this or shouldn't I, just ask your client and check with them. An easy way for that one is just, some people like hearing personal examples and hearing how I might relate to that. Other people really like to just stay focused on themselves. What would you prefer? It's the easy way
That's a
to
good,
ask.
I've
It's the easy
not
way to ask that
explicitly.
question explicitly, and
Yeah.
then the client can tell you, and then you just follow their lead.
So it will not come as a shock to you that I'm not a good rule follower. So and sometimes I almost feel like, especially if the people don't know me, it sounds kind of sociopathic, that I'm in sort of the Kohlberg's moral development, like if I don't see the need or the importance of the rule,
Hmm.
it's going to be hard for me to follow it. I can make myself,
Hmm.
but that's not my natural inclination. And that
Yeah.
is also true of being a therapist. I think I felt very stuck trying to follow the training that I
Hmm.
was given. And I don't think it works best for the type of clients that I see. I think
Yeah.
I'm very flexible and not particularly rigid.
Hmm.
And I'm going to tell you this, and I feel my worried about being judged, but okay. So like, I let my clients text me,
Hmm.
and they have my personal phone number. I don't keep two phones. I
Hmm.
don't do any of that.
Yeah.
If they want to tell me, hey, I want to remember to tell you about so and so,
Yeah.
or sometimes even just, I'm having a hard day at work, or like, I'm okay with that, because that
Hmm.
honestly is what I would need for a therapist. And this may one day come back to bite me, but I've yet to have anyone feel like they were abusing the privilege. I don't feel
Yep.
that way.
Yep.
They just need to check in with me sometimes. And I
Yep.
tell them, look, for God's sakes, if it's an emergency, get in touch with me and I'll
Hmm.
get to you the minute I can. But otherwise, basically if you want to tell me something, relatively small, I'll get to it when I get to it, but
Hmm.
you're not bothering me.
Yep.
But like, I don't have people call me constantly in crisis and blowing up
Hmm.
my phone and all the things that people worry about.
Yep.
So I exactly know what that says, but my clients really seem to relate to being able to tell me something even without a response.
Yeah, and I think, I mean, I some of what you're talking about, I mean, I probably have similar, it sounds like maybe similar-ish boundaries. I allow clients to message between appointments, I always caution anybody using digital communication because I can't ever guarantee full confidentiality in those cases, even though I use a secure app for that. But yeah, sometimes it's just I see that as an accommodation in some cases because for some people it is exactly what you said of just like, hey, this thing came up. If there isn't an expectation that I respond or that we talk about it, it's just they want me to know so I can help remember that or remind them in their appointment that we discussed this thing. And if they don't send it to me right now, they won't remember come our appointment, right? And so sometimes it's that kind of thing, or just knowing because for ADHDers in particular, many of them are verbal processors, right? And so just even being able to say, oh my goodness, this thing is happening right now, and sending me that message, that's all they needed was to put it into processing in
Exactly.
some way. And so, that is something I have really clear, explicit, like, I have some boundaries around that, and I'm explicit with my clients of what that looks like. If there's concerns or if they're concerned about it, we talk through that really directly of here's what I can do, here's what I can't do. I'm not always going to answer immediately, just all of those things. But I too have not had really it be an issue. I have had
I,
a couple
I
people.
liken it. Sorry.
Oh, I was gonna say I've had a couple people with past therapy trauma, like, and so those folks sometimes will do that a lot more because the building of the relationship is anxiety provoking because they've been hurt by past therapists. And so I actually will usually allow for that a bit, like even a bit more communication because it's part of the process. But I can tell you when that's happened, it drops off after time as that trust is built. And then
Yeah,
I
I
had
liken
somebody
it
sending me
to.
multiple messages a day, but we had a very clear agreement about what kind of responses would happen. And I hear from them only about rescheduling now between sessions.
Yeah, yeah. I liken it to the Klonopin in my purse, and I don't have any currently. But when my dad died, the my primary care doctor, they probably don't even do this anymore, but gave me a prescription for Klonopin. And then again, when I got divorced, I practically never took the Klonopin. Just knowing it was in my purse was enough.
Mhm,
And I feel the kind of similarly about that for my clients.
mhm,
Them just knowing that I'm out there, maybe reading their message, they're having a hard day at work, it's enough
mhm.
to calm their
Yeah.
nervous system. And like I said, I feel like I can't even admit it to other therapists that I have these bad boundaries. But like I said, I think also really, really before I even became a social worker, my husband and I were therapeutic house parents um, for I don't even know how to say it, what the words are these days, but kids with a lot of emotional problems. And there was a psychiatrist that I listened to who said the same thing. He's like, all my patients have my number. They never call it or they rarely call it, but
Mhm.
they just need to know that they have it.
Yeah. Yeah, absolutely. And I think, again, I think that's one of those places that is a hotly debated issue, in therapy spaces. And I think the key is that, and when I'm working with therapists, I think the key is that they identify what they do feel comfortable with, right? Because if you do extend something that crosses your own boundaries, that will build resentment in you and will impact the relationship. And so I think therapists are allowed to have their own boundaries around what works for them. But I think what is important is to look at it from what is it that I feel comfortable with and I can tolerate given my life circumstances around this versus some other person deciding what's right for a particular therapeutic relationship, right? Um, and again, the other thing I think that is important is, for many neurodivergent people, when they're upset, they don't have great access to executive functioning skills, and so problem solving and things like that, they're going to feel a lot more panic. And so I have some folks that when they message me, not having full context, I'm kind of like, it seems like my mind says it seems like there's a really obvious answer, but my client can't access that really obvious answer. And sometimes I'm uncertain of, do I send this obvious answer? Because that sounds really silly, right? Like
Yeah,
it sounds like you have to have thought about that. But the truth is, because they're so dysregulated in that moment, they haven't thought of that thing. And so me sending that, like, oh, here's an option for you, or giving them some scripting for a conversation or something, they'll respond. They're like, oh, okay. And that's all they needed. That was it.
I mean,
And it
that's
was
been
helpful for them. And so it's like,
really a growth area for me. Is I felt like in the past when I was doing therapy, and I didn't do a lot of longer term therapy, but I would feel like something was so obvious that it would be idiotic of me to say it. And I had to really work with myself on no, no, they may not have thought of this.
yeah. And I think, especially with neurodivergent folks, because we just perceive situations so differently, right? And so, or maybe they've just never been in this situation. And so they truly just don't know what one might do, right? And so, yeah, I sometimes might say, maybe I usually will add a caveat just to like prevent offending. If it is obvious, to say, maybe you have already considered this. What do you think about, or, is this an option? And then they can say, then if that's, they'll either say like, oh yeah, that would work, or it would be something like, yeah, I tried that, and then they're giving me the results of that. So we could keep problem solving. But yeah, I think that's an important thing for folks to know with working with neurodivergent people is we can't make any assumptions. So just checking, again, ask your client, check with them, what have you tried already, is a good way
That's
if you're ever not
exactly what
sure.
I'm saying. If I really don't understand the full situation, I mean, or I will say what has helped in the past.
Hmm. Yeah, so those are some good things. And yeah, I think a lot of working with neurodivergent clients is challenging some of those norms of what we have been taught, right? Because things do sometimes look different. Um, and the other thing is that so long as you communicate your boundaries clearly, a lot of times neurodivergent clients are pretty, ADHDers, autistic folks, if you state here is what is expected, and they know that most of the time, they're pretty good because they're going to follow that, right?
Well,
Unless they're like
there's a
super distressed, and that's a different situation, right?
I think there's a larger lesson in that, Bobbi-Jo, in that most people, regardless of their neurotypical people, if you will set your boundary, most people will adjust.
Yeah.
If you stick with it,
Yep.
even if they may push, they may do all kinds of things, but
Hmm.
ultimately, if you stick with it, people will adjust.
Yeah, and I think that's the other piece too, is for the therapist sides, if there's boundaries that you're not okay with, then you can refer to a therapist who has different boundaries and can accommodate that need, right, for that person, and that's a neutral thing. Again, I've had that with negotiating kind of communication between sessions where I've shared, here's what I usually do. I've had some clients who have had previous therapists where they would send them a lot of stuff, right? And that was kind of more than I was, but we were able to talk through that though and be clear of, you can send me things, but I don't communicate great through writing. So I have some boundaries that I'm not going to give you therapeutic responses to everything you send me because I don't have enough context and my brain just doesn't do well with that, right?
Yeah,
But I will acknowledge, if you want to send me this, I will say thank you for sharing that, or I'll acknowledge that I've read it, and unless there's like something direct that I can answer, so I've been able to negotiate that. Otherwise, though, we got to a place that was early in our first intake session that we could have, if that client felt like they needed somebody who did like full narrative therapy back and forth regularly, I would have tried to help them find somebody who provides
hmm
that, right? And that's
yeah,
fine. Um, which is, I guess, the key then comes back to having that really clear, direct communication about what are those boundaries overall and really spending time. I spend a lot of time, probably more than most, in intakes, just talking through how I work and my
yeah,
expectations. I ask the client about their expectations, what they need for accommodations, and we spend a lot of our time just negotiating that before
yeah,
we even jump into their story. And I don't know that some therapists do that, but I don't know that as many do that. But I find that when I do that, I don't have a lot of the issues that people worry about having or
right.
think
And I
about
guess
having.
would I would want other therapists to know that, maybe because I am private pay, and people when they choose me, they are not in any way, I guess, settling, because I have a pretty good rate now, and it's been very difficult for me to be okay with that, but
Hmm.
they have their choice of people at my rate and
Hmm.
specialization. So I would like for therapists to know that the fear that's made out for us in graduate school about boundaries has not been my experience. I
Hmm.
don't have people calling me in the middle of the night or early in the morning, or, honestly, in crisis. I think I avoid crisis because they can say, I'm having a tough day, and then
Yeah.
move on.
Yeah. Yeah, I would agree. I think that, yeah, there's a lot of things that we have to kind of unlearn. I guess with all of that, is there any accommodations that you related to ADHD in any way that you would want from a therapist? And this could be like imaginary world, right? Of the system looks very different, or it can be just, very realistic.
Well, I think, just directly to what we're talking about, having it be okay that I say, same thing I give to my client, the same thing I give to my clients, remind me to tell you about this. I want to tell you about this, or, even, this might be a helpful resource, or just kind of that, with that sort of minimal, what I would consider sharing, not calling in repeated crisis, but um, and then I still haven't quite worked out with my own therapist how the sessions will go. I mean, I think she has an agenda with somatic therapy,
Hmm.
and my needs are different depending on the day.
Hmm.
Sometimes I need to really just do a brain dump and
Hmm.
then get her to help me untangle it. That's probably primarily what I need.
Yeah, so
Um,
that accommodation of we can have some identified therapy goals that we're going to work on, but you need for that therapist to be flexible, that and acknowledging that some days what you might need, you might have had a plan of next session we're going to address this, but today something happened and I really need help with this other thing over here.
I think that's a challenge for working with neurodivergent people. I almost think that we could divide up the sessions most times into two parts. We
Hmm.
could divide it up into that brain dump and untangling the Christmas lights
Hmm.
with me, and and make time for some kind of a somatic exercise. Because if I just brain dump, we'll never get to that,
Yep.
because I could brain dump for the next 6 hours.
Yep.
So I don't know where the balance is. And I think
Hmm.
it's something for me to consider with my own clients. Like,
Yep.
when do you need to just talk about all the things?
Yeah.
And then when do we need some time for teaching and learning, resource development, and maybe some skills? So
Yep.
maybe you have ideas about that, but that's what I'm thinking in my head.
Yeah, I mean, my suggestion goes back. The answer is always ask your client and talk about it with the client and contract with the client, and how that looks for each client will be different, right? Because there are some clients who, if you allow them to just go off, I call it spinning, kind of like the spinning around in all the
Yeah,
different topics, right? And most ADHDers will start sessions by doing that because we struggle to organize our thoughts. So even if you ask us what's happened, we're gonna spin, right? And so
I
how
didn't know,
long that
and I'm
how
writing that down.
how long that goes on for is, I think, is again sometimes just doing that, like you said, that brain dumping is another word for what's happening there, right? Sometimes doing that in and of itself is therapeutic and helpful, and not stopping it is helpful because often we have to pull that together so much in our life that having a space where we're allowed to just be our true selves is super helpful. On the other hand, sometimes though, if we, as you said, if we do that or we start doing it and get off topic on things that really aren't so important, people get upset that they've wasted their time.
Right.
And so again, that's something that I often, I kind of just let it go the first couple sessions and just see what their natural pattern is or kind of where it takes us. But if I notice that that happens a lot, I will usually just reflect that and say, you know, I've noticed that this happens. How would you like me to respond? Do you want me to let you go? Is that helpful for you? And I normalize. Some people find it helpful to just do that. And I'm happy to do that if that's what you want. Some people want for me to interrupt them and have us do some other kind of work and really want to get to that stuff. do you have a sense of what's best? Sometimes people don't know, what they need or want
Right.
either, but I try to reflect and ask that. The other thing, I know this is something I steal, my own therapist does. And again, we've agreed to do IFS and kind of that's our frame. So the goal is to go inside and do the deeper work. But there are some days we spend more time with the processing, and other times, we can go right into the processing or the deeper stuff. And so he will usually just say something along the lines of, "Is this something you'd like to slow down and examine a little bit more? Is there something else that feels more pressing or more important?" And
Oh
that's a
yeah.
really good and I use that now all the time. That's a really good reframe because it allows them to check in then. Is this important? If yes, then let's slow it down. If not, then it usually redirects them to something else that feels kind of more important, right? And even just the asking of that prompt, at least if you're doing IFS, forces them to kind of go inside and check in with what feels important, right?
I'll
Um,
say that for therapists out there, I think one of the most lovely things about us is that we're never at a loss for things to say. So you never have to worry that we're going to make you sit in an uncomfortable silence waiting for you to come up with the brilliance.
yeah.
So I think that's one thing my therapist has expressed is that her frustration in working with clients, which is about the only thing she's told me, is not what I bring, because maybe I frustrate people sometimes with that. It's the clients who sort of sit there, who come week after week and kind of sit there with not much to say, like, why are you paying for this? I don't know. But you'll never have that problem with ADHD clients. And so I think that should be reassuring on some level. The other thing that I've learned, which might be helpful to people mostly from my EMDR work, is I've started offering to my clients, and we will do it back and forth, okay, stop for a second. They can say stop, I can say stop. Hand
Mhm.
signal, stop. Let's belabor this point a little. Let's stop and tease that out. Let's see the importance of what just happened here. So I'm trying to teach my clients that we can both use that. If you don't like
Mhm.
stop, sometimes we'll say pause for a second, especially
Mhm.
when you're working with an ADHD person. Sometimes you got to say, pause for a second. What you said was important. Let's go
Mhm.
back to it.
Yep.
And also sort of the container exercise, which you can use in EMDR or anything else, putting things in a container, because we do have 50,000 things going on in our head. We want to say, well, this issue with my daughter is important, but I don't want to focus on that right now. Let's put it in the container, or let's put it on the shelf. And I'll
Mhm.
physically make a reminder to myself, we just put daughter Isabel on the shelf. And my
Mhm.
clients really like that. That feels organizing to them.
Yep. Yeah, and I think that's where those negotiations with clients of how do you want to manage these things, and just asking them and coming up with systems with each of them, and then following through with them. So some people, it is helpful to say, last time we agreed we were going to work on this thing, but let's check in. Do you want to still focus on that today? Sometimes that's helpful, because maybe there's something there. And I think that's the other thing for me that's important, is that I think that willingness to go there, sometimes simply problem solving with somebody is the most helpful thing you can do for them, right? um I and I think that's especially true if you're working in some of those deeper therapy models, right? Like, um I have somebody I've worked with, and they had a situation where they had just a ton of things on their plate and were completely overwhelmed with the executive functioning of figuring it all out, right? I could have addressed all of those parts that were showing up and sat with and talked about the deeper levels, but that wasn't going to shift their schedule that needed to get figured out. I offered them the choice, do you want to check in with us around parts, or would it be more helpful if we just like walked through your schedule? And they chose to do the scheduling. I mean, all I literally did was have them word vomit all the things they needed to do,
Yeah.
and then we went through day by day and made a plan. And then they came back the next week. They had, as well as an ADHDer can, followed the plan. By doing that, we were able to see there was a lot more blocks of time in their schedule than they originally thought. And so they felt, I mean, they reported just in that session that they felt much more calm and much more capable of getting through it. And I don't think we would have had that same impact had I went to doing deeper work with the parts, right? Because not the reality wouldn't have been resolved. And so I think that's good for folks to know too, is that with ADHDers being more willing, because they often just need that support of a regulated person to help them use that organizational skill or other executive functionings that are required. And so sometimes what seems like not much is the most helpful intervention on that particular day.
100%.
Any quick last, just general ADHD management strategies that you've picked up in your own life that have been game changers or super helpful for you?
Again, one of my things I fear I'll be judged for, but I live in the country. I have a key fob that has a button press. I leave my keys in the car.
Okay. Then you don't have
And
to worry about losing them.
yeah, I
Yeah.
always know where they are. Even
Hmm.
if I lost them in the car, which has never happened, I can still start the car. They're still in there.
Hmm.
So that's one of my, and I get a lot of flack from like my family about it. And maybe when I move, I won't be able to do that. But that is an accommodation for me.
Hmm. Yeah, I mean, I think there's a lot of things that people have to do because they work for them, right? And there is always risks. And I mean, I think it's important to notice with risks like that, if somebody's going to take advantage of you, they're going to, and they could, whether you leave the keys in the car, they can figure out a way to steal your car if they really wanted to steal your car, right? Yes, you may have made it a few steps easier for them, but the chance that that might happen someday versus the amount of distress it's going to cause you to live your life on a daily basis,
I've actually
there's
almost
some
never,
risks like that are worth it, right? Like,
so it really even wasn't about losing my keys because I've almost never lost my keys, but it's a mental load that I take off of myself that I always know where they are.
absolutely, that makes sense to me. Yeah, I mean, I think it's really just about adapting and finding what works for you, and the less things that you have to think about and process, always the better. Um, well, I really appreciate your time today and sharing everything that you have with us. Any last thoughts that you want to share? Anything I didn't
I
ask
mean,
you about?
this is, because of the way I am, this is also hugely helpful and therapeutic for me. I
Mhm.
both learn from you and from my external processing. So I am more than happy to talk to you and do this again if you like, and take it wherever you want to take it. I am looking forward to a better day for all of us with neurodivergent brains.
Yeah, thank you so much for sharing your time.